Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. In this video, the CDC has some new guidance out, one about quarantine after exposure in someone who has been vaccinated, and another about double masking. You may have heard about both of these. In both instances, though, there's more to the story than what you're hearing, so please share this with someone you care about. The CDC announced that a person who has been vaccinated does not have to quarantine if exposed to someone who is suspected or known to be positive. Unfortunately, the media announced this, but left out a couple important caveats. So first, this only applies to someone who is at least 2 weeks after their second dose. And that's because it takes the immune system roughly 10 to 21 days to produce antibodies. And in the studies, they measured this effect at 14 days. So that's the recommendation. Second, and super important, this only applies to the 90-day period after the second dose. Now here, they are extrapolating from the experience of those who have gotten infected and then were reinfected. And it was observed that for a 90-day period after the infection, the risk of getting infected again and being contagious to others is super low. The immune response to vaccination has been shown to be even more robust after vaccination compared to after infection. So the CDC assumes the same. So right now, exposure after 90 days still means quarantine. So a big concern has been whether a vaccinated person could still harbor virus that they could give to others. And there is some data out last week that for the J&J vaccine, one that is seeking approval but not yet approved, transmission is reduced. And so perhaps this will pan out the same with the mRNA vaccines that we have now, Pfizer and Moderna. We'll know more over the next few months, and perhaps that 90-day caveat can be extended. But for now, that's the guidance. And remember, the vaccines are 95% effective in preventing illness, not 100%. Thus, the need to continue protective public health measures. And this leads to the third caveat, which is as long as the person does not develop symptoms. That would terminate this advice. So, more than 2 weeks after your vaccination, you get suggestive symptoms, you would need to isolate and get tested. What about double masking? The CDC released results from a study about masks, recommending double mask with a cloth face covering over a surgical mask, especially in high-risk situations like crowds where others are not being careful with masking distance and the like. And specifically, it referred to a 3-ply face covering over a 3-ply surgical mask. And in the experiment, roughly half of cough droplets from an unmasked source were blocked by a disposable mask. Combining as a disposable mask with a cloth mask on top, that blocked 92.5% of the particles. And if both the infected person and the exposed person used double masks, that rose to 96.4%. Now, these are not really new findings. And these percentages have been demonstrated in the past with masking. The real news here was that the effectiveness reported was dependent on good fit. The sides of the mask were tucked in, the top of the mask tight against the face. So that is the takeaway here. If you want the best protection from a face covering, make sure you have a good fit no matter what you use. Kind of like my buddy here, right? So one way is to tie a knot in the elastic strap right next to the mask itself. The sides then lie against the face, and the metal bar squeezed tight against the nose and cheeks. And here's a video describing the technique. So here's a technique that uses a rubber band, or 3 rubber bands woven together for a better seal. And here's a link to that. So be well and be careful, especially right now.